Okay, very good morning to everyone. Today is 16 September 2021. Okay, Thursday. Supposed to be a meeting on Wednesday because I got something on yesterday, then cannot make it. So that's why we postpone it to today. Okay, so once in a while we will give you the early changes, updates, if any changes. Okay, so today our topic is more on diabetes. Listen carefully all the fact that I'm going to tell you later. Okay, and if you have any questions, write down the questions. End of the sessions, we can discuss about it. Okay, it's very important to know about the diabetes. Okay, to know about all in and out about diabetes. Today I will come out with so many information, and everything got reason. Okay, diabetes is not a disease, but currently we all scared with something that not been can be handled by the humans. Okay, easily we can handle it, but because of the freight, you're afraid that you will lose this, lose that. It end of the day become disaster back to you. End of the day, you no need to afraid of anything. Okay, so let me start the slides. Let me share the slide, share screen, back to the diabetes, share. Okay, can everyone see? Okay, can everyone see the slides? Just double check.
Can, Doc.
Can, so please update me if there's a slides, it's not changes. Okay, so today's topic is how to balance diabetes using Ganotherapy method. And what is diabetes about? Okay, very interesting topic that you all should to know and learn to teach other people after this session. Okay, what is diabetes? Okay, so you need to know what is diabetes first before you worried about diabetes. The definition based on the Google or medical book you can see here, diabetes is actually a disorder of metabolism. Okay, it's disorder of the metabolism causing excessive thirst, okay, and the production of large amount of urine. Okay, so please understand this fact. Diabetes is disorder of metabolism. What is metabolism? Metabolism is your digestion system. Okay, digestion system. When your digestion system is not balanced, your water balancing is not there. Okay, what happened? It creates a lot of thirst. Okay, because the water production is not correct and lot of digestion not happening into your system, your food is already disorder, your glucose already disorder. Okay, your glucose already disorder. Okay, end up with production of large amounts of urine. Okay, so please understand these things. Disorder of metabolism means the food you eat not converted into a good glucose, okay, and it become a bad glucose that body need to extract it through the urination. Okay, so if your body want to extract from the urination, what are the organs are related is kidney. Okay, so kidney is, what is the kidney job? To remove that what do you call soluble items. Okay, to remove soluble item such as salt and sugar from the body towards out from the body. This is the definition, actual definition. So because the too much of water has been removed to cleanse your system, the production of large amount of urine is to cleanse your system, because the body don't want the large amount of sugar stayed in your body, so it start to remove it from the system. Okay, push it out. Okay, to push it out. Okay, now we go some more. Okay. Okay, here you see there's too many people. It's keep on popping up. Okay, so you see alarming increase in diabetes in Malaysia. This is fact until 2016. I cannot get the latest one, but later I'll find out. But if you see, even though the latest one, the incremental rate is keep on increasing. Malaysia is highest in Asian. If you see fattest in the Malaysia, also we are the number one. We always good number one in the bad, not the number one in the good. This is always reverse. I don't know what happened to Malaysia. We always number one in the bad things, not the good things. Okay. So every year diabetes are increasing. Why? People are so scared. When people are so scared, a simple things also you're going to check, end of the day, the industry change you as a diabetes patient. Even though you're not a diabetes patient yet, but because of you are listening to them, you are scared, you convert yourself into diabetes. You're not diabetes yet, you know. I tell you, so many people in Malaysia, they are not diabetes because when they meet up doctors, pharmaceutical doctors, because of the guideline has been reduced so much. So they follow the guideline and straight away they put you in the medication. But none of the people who take the medication recovered, end up with disaster, end up with so many type of medicine, end up with a lot of organs failure, end up with kidney failure, amputation, and end up with dialysis. That's how you are routing it. But a lot of things that we can change in our lifestyle. Okay, later we come out how to change the lifestyle. Okay, we go on. Okay, diabetes in Malaysia. Recently, the fact come out is like in 2019, 1 in 5 adult Malaysia have diabetes. You know, the 1 in 5 also because your problem. You simply go and check after makan. You don't know the situation, how the diabetes is. But end up, you simply go and check. Okay? Then you make yourself as a diabetes. And nowadays, people age 18 years above, because of the parents are diabetes, they scared about the children, they bring the children to the hospital, make them diabetes also. Suppose you don't need to worry at all. If the person is in a healthy condition, they don't lose weight in immediate thing, they are okay, you just leave it. Because nowadays kids, their trend of eating food is totally different. So we need to take care of their food, not put them in the medication system very early. Okay, unless they are 60, 70 years is different case. Unless their digestion rate completely fail is different case. But simply we put them into a diabetes category. That is the first mistake that people are doing nowadays. You need to find out, you need to monitor, you need to make sure the system is fine or not. If the person eating too much of sugar, you need to maintain, you need to reduce the sugar intake to that. If the children is in a high intake of a carbonated drink, you should stop them. Take more plain water. Okay, eat in the correct time. Okay, so there's a lot of things that you can change. Ask them to go and do exercise, sweat. Okay, then diabetes won't occur. Okay, in terms, diabetes is metabolism weakness. If you come to metabolism weakness, it's everything about your food. Everything is about your food. You balance your food, you balance everything. Okay, so the pharmaceutical industry, nowadays people are very lazy. So they know, okay, everybody lazy, never change the glucose into energy. Okay, never change the glucose into energy. So very easy. What they do? Okay, they know, okay, everybody checking everywhere. They do show, okay, the pharmaceutical industry do the road show in an airport, in a, what do you call it, in a shopping center. So you keep on going and check. Then suddenly you go say, just you take your lunch. Then suddenly go and check 6, 7. Then they say you are diabetes. If you don't take, your kidney will fail, this will fail, that will fail, they scan you. Then you start to corrupt your brain ready. Then end up, you start to eat the medicine. But after 10 years also never solved, you eating more medicine, end up with the insulin, end up with losing your leg, losing your kidney. Okay, these are the things is happening in Malaysia. Okay, so you must be brave enough. Okay, you must be brave enough. So to make sure you are not fear. Okay, you need to understand which are the correct route or correct path you need to go before you touch the medication system. Because the moment you touch, you have no way out really, unless somebody teach you how to bring it out. But none of the people nowadays are they all putting you into the system, but they don't want to release you out because it's a big industry. Okay, when it is a big industry, okay, you simply cannot go out to the system and they won't let you go out. By end of the day, you become more sick, more sick, more sick, not healthy. That is the trend nowadays. Okay, so you must make sure a lot of information you need to know. And where is the failure is happened, you need to stop the failure and go back to their right path. Okay, you see nowadays sugar tax, Malaysian cut back on soft drink. You see soda and sugar consumption, 36% of a Malaysian student carbonated soft. So another, when we keep on taking 10 years, okay, they are increasing the amount of sugar inside the body without no exercise. Okay, non-controlled food eating. All these things will become a toxic and stay inside your body and saturated inside your body. And you can see nowadays children like to, not only children, nowadays people like to eat after 10 o'clock. Okay, after 10 is the worst food you are taking. Don't ever take meals after 10. The last meal that you should take is 8 to 8:30 finish. If you want to take, you just take a normal milk, plain milk or a cocoa, whatever, but without sugar, or plain water. That is the best. The supper is supposed to be lightest as possible, and it should not be a solid food. Okay, and skipping breakfast is the worst scenario for diabetes people. You should not skip your breakfast. You must eat something in the morning to make sure the acidity function in the stomach has been diluted or has been neutralized before you are going for the next meal after the breakfast. Okay, so breakfast is very, very important. Okay, very, very important. Remember that. Okay, how sugar flow? This is a blood sugar flow chart. How does this happen? Okay, see, when you eat, okay, when you eat, okay, your food is converted into glucose. Okay, so the blood sugar, it becomes glucose promotes. So the moment you have glucose, what is the pancreas job? Convert it to insulin. Okay, take the glucose, give the insulin to make sure the glucose will be absorbed by the tissue cells. So the moment glucose, insulin is given to the glucose, okay, the right glucose, okay, the tissue will get taken it and become energy. Okay, and if the glucose is lesser, okay, if lesser, low blood sugar, it will send promotes glucogen release. So let's say your glucose already reduced in your body lacks glucose. If you have a storage glucogen, okay, glucogen is the form of let's say you have 10 glucose. Okay, then you have insulin, but the body only use 5 glucose, 5 insulin for energy. So you got balance 5 insulin and 5 glucose that already verified. That glucose will be converted into glucogen and keep into the liver. Okay, it will keep into the liver. So when the low blood sugar is signaling back, so the pancreas when send a glucogen signaling to the liver will release the glycogen to the sugar. So you will back up again. So that's how the body works. So additional sugar that we eat will be converted into glycogen. Okay, glycogen will be raised into things. So it will convert it. Okay, if first glucose you take, it will go into a glucose and body will release the insulin, you will absorb it directly. Additional change to glucogen, storage in the liver, whenever needed, it will break down into the thing. This is how the system is working. So you always remember, when we eat, after we eat, we need to eat in a proper way. That's why eating habit is very, very important to make sure the metabolism is being 100% perfectly designed. That is very, very important. Nowadays, people don't eat, they swallow the food. Okay, how you expect your stomach munch for you. Your stomach don't have teeth to munch. So you must remember the process must be perfectly designed for you. You must do it yourself. If you don't do it yourself, that's why you never convert the everything into a proper flow chart. When you don't have proper chart, your what do you call your process is failed. Let's say in a factory, when you give a raw material, the first process they convert the raw material into a certain subject. Then after come to the second department, it will change to the second subject, second subject, third and fourth will be a complete product. So to get a complete product from the raw material, you will go through several processes in a factory. Okay, same if anything fail into any department, let's say we have 3 departments, raw material come to first department, changing of the format, then it goes to second department, changing of the format, third is completed, fourth is output. So the output must be correct things without any rejection. Then the QC will check, okay, whether that product is a complete or not. If the product is failed, rejected, he will go back to the department, which department is as the failure. Maybe second department has the failure. So you will tell the second department, say that, okay, your department has the failure, please rectify the failure and prepare it. So the failure has been identified, then the complete product, no more reject ready. But in our human body, we have so many rejection area, but nobody will identify that. Okay, nobody want to know that. When you go to the hospital, they never tell you which department is failure, how to balance that department. But they just modified the output to make sure it been used. Okay, let's me you modify it. How long are you going to modify it? The more you modify, the department is not being rectified, end up the department completely in failure. When the department completely in failure, what will happen? The overall system getting failure, because from the material, the last production is being used by other organs to perform. So when you fail in one department, every system is start to fail. End up with increasing medicine one by one. Your sugar will your cholesterol will raise, your liver will failure, your kidney is crop, your blood circulation, you don't have a production of the glucose. You see, you must remember 60 trillion cells are depending glucose to live. Okay, 60 trillion cells as a human being depending on glucose to live. If you don't have glucose in your body, you go hospital, they give you glucose water. Okay, to make sure your energy come back. So your energy need a carbo that can convert into a glucose. But that glucose need to get an insulin verified, pancreas to verify it. Okay, so we go some more. Okay, you see here, pancreas secretes around 40 to 50 units insulin daily in stool tap. Secreted at low level during fasting. Okay, increased level after eating, prandial. So, okay, prandial is after eating. So automatically, when you eat, your insulin level will increase. Your food is because your food is start to converting into glucose. When you start to eat, the production 100 glucose, 200 glucose, 300 glucose keep on increasing. To verify all this glucose, pancreas will take in charge to balance the glucose, to check the glucose whether it's good one or bad one. If a good one, it will give insulin, verified. Okay, QC passed. If you bad one, it will be pushed into your urination to get it out from the body. So that's how the body works. So when your urine got sugar, means that your body is secreting a lot of glucose out from the body. Means that your digestion system is not good. Okay, when your digestion system not good, that means your metabolism is failed. So you have a lot of rejection. Okay, you have a lot of rejection. So you need to correct the eating style. Okay, metabolism. You need to correct the metabolism to make sure every glucose that you eat is being used perfectly, is being verified perfectly, and is given insulin accordingly. Okay, if you eat, after you eat, you got 100 glucose. Out of 100 glucose, you got 10 glucose fail. Okay, 90 glucose passed, verified, and get insulin. Okay, 10 glucose never get insulin. So the 90 will used by the cells in our body. but the 10 will be removed from the body. Before it removed in the urine, it's stored in your body first, in the blood. Okay, if this bad one is high, then you can see your sugar level is high. If it low, you will see a low sugar level. So these are things. But after you urinated, it will go back to normal. That's why morning when you eat, your sugar high, then evening and getting evening and evening, it will go back to normal because the body start to eliminate it from the system. So that's how the system is working. So none of our pancreas is failed. It's only metabolism fails, production fail. So we cannot ask the QC in charge on this. The problem is in the department, not at the QC. The QC job is to verify only. So nowadays what we do, we bribe the QC to pass the rejected glucose. That's you are doing now with the medication system. So it's totally wrong what you're doing. You never solve the actual problem. You are just firefighting on that moment only. But every day you're firefighting, one day the whole system will fail, will burn out. Okay, that's why your total sugar level go down and you become you fainted lah. Okay. Okay, we go on. Okay, now you think, okay, is the diabetes only problem at pancreas and liver? Actually, no. So you must clear the metabolism part. Pancreas and liver playing a secondary part. The primary part is your mouth, your stomach, and your small intestine. Secondary part, your pancreas and liver. So first department, mouth, okay. Second department is your stomach. Third department is your stomach. Okay, if these three departments working well, your pancreas and liver will function properly. Okay, so who produces the glucose from the body? Your digestion. The first department is producing. First, second, the third department produces the glucose. Okay, I'll show you how the glucose created. Okay, so you see now food. Okay, flowchart how to produce good glucose rather than the bad one. How to get a good metabolism. So you have food. When you have food, okay, you eat the food. You eat it, you munch it. Okay, you munch it and you munch it with amylase. Okay, amylase is your saliva. So when you have food, you munch slowly. When you start to munch slowly, you mix the food into amylase. Okay, so when you start to munch the food into amylase, this is the first department in your mouth. Okay. Okay, now food break into small particles. Where? In the mouth. Okay. After that, okay, the food has been transferred into stomach. In the stomach, you can see we have several enzymes such as enzyme, peptine, renin, acid hydrochloric, everything. Okay. Then from there, the food is processed with all the enzyme and sent to small intestine. Okay, so the mouth is the first department, the stomach is the second department, the small intestine is the third department. So what will happen now? Okay, so in a small intestine, good glucose has been produced. Okay, good glucose has been produced. When good glucose has been produced, it been streamed to the blood. When it streamed to the blood, pancreas will check the glucose and verify it. Good one, given insulin, bad one rejected. So the rejected one will go to the urine. Okay, the good one will absorb to the cells. So 60 trillion cells will start to utilize your glucose and try to run the show. Okay, this is a simple basic process. So you need to make sure the basic process of the mouth, stomach, and intestine are perfectly utilized first. Okay, perfectly utilized first. That's very, very important. Okay, so you see the stomach. Okay, small intestine. Okay, main problem raises glucose production. Good glucose, good digestion. Bad glucose, bad digestion. Then you have small intestine failure. Okay, let's say a lot of people say small ulcer, gastric, all these things, acidic high. Then how you expect you have a good glucose? Okay, Then if your colon keep on produce bad glucose and we push the bad glucose to our cell using all the diabetes drug, this will damage all our cells. So insulin even more worse, and due to it's not human at all. You see, the moment your bad glucose has been created in your things, okay, so in your stomach, it released to your bloodstream, okay, then pancreas will check, hey, you are all the bad one. So pancreas never verified it, okay, never verified it. If we not verified, okay, if it verified, we have a additional and balance. The used one, the current used, the balanced one, we can try change to glycogen keep in the liver. Okay, so the glycogen keep in the liver is actually a storage that can be used later part when your body really out of glucose. Okay, so it's like a bank. It's like a bank. Okay, it's like a saving bank. Okay, so when your pancreas start to release it, you can see your body is working well. Okay, your body becoming well. If it not, then your body become unwell. So you will have a headache, a body will become thin, you have so much of reactions. So in that time, what we do, they're giving you a medicine to balance the glucose level, push all the glucose, the bad one, into your cell. So when the cell is starvation, you give the bad one also, you will eat. Okay, so you will eat. But after a long run, the cells start to die because you keep on eating the bad glucose. Okay, bad glucose. Okay, see, this is the enzyme process table. Okay, where it is made. Okay, this is very important. Huh? You see salivary glands. Where it works? In the mouth. What type of enzyme? Amylase. What are the substrate has been used? Starch. Okay, starch. So what are the output is maltose. So you see salivary gland is in the mouth. The enzyme is amylase. The changeable, the substrate is a starch. The output is a maltose. Okay. Then you see stomach cell. Stomach cell in the stomach. Okay. What are the enzyme used? Protease. Okay. What are the substrate? Protein. So the protein has been used. Okay. Enzyme is protease. Substrate is protein from your food. And the product output is amino acid. Okay. Then you see liver. What is the liver job? Liver, where it works, it secretes into small intestine. Okay. The enzyme is bile salt. Okay. Subtract the fat that you eat, and it become a fat product, fat droplets in the last product, the output. Okay. Pancreas secreted insulin in small intestine. Okay. What are there's three types: amylase, protease, lipase. Amylase for the starch, convert to maltose. Okay, protease for the protein, amino acid, lipase for the fat, glycerol and fatty acid. Okay, small intestine the way it works, enzyme maltase and protease. Okay, substrate maltose and protein. So in the small intestine, the maltose is taken, okay, to convert to glucose. Okay, maltase enzyme use is maltase in small intestine. Okay, so in a small intestine, you can see the maltose. Okay, maltose. Okay, from the salivary gland maltose, when it goes to the small intestine, okay, so the small intestine will release the maltase enzyme, take the maltose from the salivary gland, the first is created, okay, going down to your small intestine, and it converted into glucose. So it means that if you don't prepare your amylase properly, you don't have the output properly. If you don't have a complete product properly, then you don't have a complete glucose later. So all these things is very, very important for you to understand where it starts and where it ends. If you perfectly utilize all these items, you don't have cholesterol, you don't have a kidney failure, you don't have a imbalance of system, everything will work perfectly. Okay, everything will work. It's all in your hand. But what you do, you want a shortcut method to bypass everything. When you start to bypass everything, you are failuring every organs slowly into 5 to 10 years, 5 to 15 years time frame. In 5 to 15 years time frame, sure your kidney will fail, your liver will fail, your blood become thick. Everything start to fail one by one. But if you remove everything, go back to reality, change your metabolism balancing, change your eating habit, balance the product, clean the toxin from the body, okay, and I tell you, you can come back to the normal condition. You no need to worry about kidney failure, leg amputated. But if you want to leg amputated or kidney failure, you can continue the system, the current system lah, okay, current system. You don't want to change all these things. End of the day, you will lose out. That's why I see when we want to, you see, this is the uncontrolled changeable variables. Okay, glucose, all these things are changeable variables. It keep on go up, it keep on go down. It's keep on changing in every day, every moment, every minutes. So you cannot fix, okay, the changeable variables into a fixed variables. So glucose is a changeable variables. When you start to fix it, become fixed variables, then you got a problem. Okay, so the modern medication system tried to fix it into a fixed variables. Oh, don't more than 5. It start to push it to start to suppress it to 5, 4, 3, 2, like that. So it more suppress and suppress and suppress, the more damage you're going created because you are reducing the supply to the cells, the food to the cells. The food to the cells is what? Glucose. Okay, if you don't get the glucose, if you don't get the insulin from the glucose, then you start your problem ready. Okay. Okay. What are the problems? Okay. The effect of the diabetes on the body. These are the effect. Okay. This effect has been solved by taking a medication system. Okay. But still exists. People take 10 years medicine, also kidney failure. People go 10 years medicine, also taking high blood pressure medicine, become high blood. First they don't have, later they come back. People are controlled taking medicine and insulin, also got stomach problem, food problem, heart problem, everything is coming in. So I don't say modern medication is not good, but you need emergency medicine, okay, temporary, okay, but in the long run, you need to change. You need to know where to tackle, which department to be solved. So when you know and understand which department to solve and how to balance back your system, slowly you can come out from all the diseases. Because in a modern medication environment, they also, the doctors also encourage you to do what? To do exercise, eat a good food, don't go and take all this carbonated drink, okay? So many things they're telling, but it's all in your hand to balance it. But if you're depending on one source and keep on, okay, I'm taking medicine, I just controlling, taking insulin, taking medicine, you're controlling, end of the day, you're not controlling, you make the system worse. Okay, you make the system worse. You need to change and balance it back. Okay, now, okay, by pushing the bad glucose to all our body cells once, body cells one by sickness will increase with us. Okay, correct eating habits are very important to make sure good glucose are produced. Taking a right medication such as Ganoderma will repair and balance back all the glucose production and enhance the production of insulin, liver production, and things. Why? Because Ganoderma intake is to not to solve your diabetes problem, no, to balance your cell, to repair your cells. The damaged cell has been repaired back. The toxic has been removed. Okay, when the toxic removed, the new cells are start to promote. So your liver is regenerating, your what do you call, your pancreas are regenerating. So when your pancreas cell start to regenerate back, so the production can be balanced. So when the production has been balanced, your eating habit also balanced, then slowly you start to go out from the problem. Okay, you start to solve your problem slowly. Okay, so this is the mean glucose level you see last time. Okay, last time they see, okay, they said 8. Okay, HbA1c 8. Okay, it's a good. Below 8 HbA1c and mean glucose level 180, that means the glucose in Malaysia, we have Malaysia calculation equal 10. So it's still in a good condition. You're not necessary of taking medicine yet. So you need to balancing, no need drugs, medication. You can balance it with Ganotherapy, okay? And not necessary you put a drugs now, okay? So if it goes more than, what do you call, 11, 10 above, okay? So HbA1c 9 above, then you need certain medication with Ganotherapy together to bring down it below than 10 and below than 8 HbA1c. So when you start to come out below than 8 or below than 10 ml per time, okay, you no need to worry. You can slowly reduce the drugs and you can maintain your exercise, food, everything you change. Then slowly your system become more into the excellent condition. Okay, I've proved so many cases in reverse back. Because the problem is the moment you got 6 or 6.57, immediately you go and take medicine. This is the real chart that's been used previously. After that, it's been changed. Okay, now you see 5.5, okay, it's already the point, they put it under the category HbA1c 5.5, okay, Mg 115 mol is 6.4. So the moment this is the latest things, they already bring it down. The more they bring it down, the more damage you are creating. Okay, so in reality, last time they used the correct one, but after that they see, every time when they reduce the reading, the more and more people are become diabetes. It's not diabetes are increasing, diabetes has been creating. You must understand that diabetes is creating by reducing the thing. So in 2002, 6.6 is already reduced to 5.5 into that. So in that moment, 24 hours within, okay, about millions of people become diabetes in the next day. Okay, after they change change the reading, bring it down. So we must understand that if we bring down one reading down, we should see the improvement. Okay, but here we bring it down, we don't see the improvement. We see the incremental of diabetes patient, the incremental of drugs taken is increasing. So the drug company immediately in 24 hours make $100 to $200 million because of you follow this kind of scenario. You don't change. Okay, you follow the blind. We are following blindly. So that's why so many people say now why every year case increasing, because they're scared. Father got diabetes, mother got diabetes, son also, they bring the whole family they bring to the system. They check everybody diabetes. The boy just drinking 1 glass of Milo. That guy also you bring into diabetes, then straight away take medicine. Okay, by end of the day, in 10 years he start medicine, by 20 years his kidney failure. So many kids I see kidney failure now in dialysis. Okay, why? Because they started in 10 years. Why you started in 10 years? Actually, you don't have diabetes. You never change it according to the food. You never play with food. You never teach him how to eat. But you bring it to hospital, you become diabetes. Then did they help the boy? No. End up the boy in dialysis center in 20 years old. So many I see in my experience, so many children I see. When the parents bring back to me, I see, wow, 9 years start diabetes. I say, how come 9 years you got diabetes? Because father went to diabetes checking, the children also they bring together. Okay, and when he have a lot of malnutrition problem, they don't see that. They go and check the sugar, then say. When the children sick, they go and check the diabetes, they put him on diabetes. When you sick, sure the glucose level, pressure level, everything go up. So you need to maintain, give the good food, give the soup, all these kind of things to balance the food. Okay, but you don't do that. End of the day, you give them, start to give insulin, start to give medicine, end up in failure. Okay, so we go on. Okay, so you see, unfortunately, there's not yet a cure for diabetes in modern medication due to keep on treat the output. Why? Because we try to keep on treat the output, glucose. Okay, if glucose high, straight away kill the glucose, or you push the glucose into the cell by using tablets. Using tablets, metformin, all these kind of tablets, you push the pancreas to release the insulin, push the glucose into the cell. You don't care it's a bad glucose or good glucose. Okay, if you put insulin, you kill all the glucose. So in the both cases, in the tablet cases, you are putting the cell into a bad glucose. Okay, force the cells to eat the bad glucose. But in insulin, you clean the glucose, you wash the glucose, okay, and you put the cell into starvation mode. So both is killing your system. End up you get disaster. Okay, so using alternative treatments such as Ganotherapy, potential to reduce and balance your diabetes issue as onset all. Okay, it's not a medical miracle, it works in short-term plan. Okay, it shall take a period of time to see the bad result. Included with balancing the metabolism. Okay, you need to learn how to balance also. Okay, by following good diet, exercise plan, body may helpful to the system to burn excessive glucose to convert to energy. You must understand that. That's why you see a lot of athletics don't have diabetes. Why? They every day burning the glucose, become energy. So they burn the glucose, become energy, then they eat. When they eat, sure the glucose will go up, but in the correct mode, correct timing, because the athletic all they have a proper diet plan. They don't simply eat. Okay, they have to eat according to the certain diet plan. But you can see their improvement. Okay, so you will realize the shocking reason why everything you know about the managing diabetes is that wrong. Okay, so she can completely and permanently reverse both type 1 and type 2 diabetes as little as a few weeks from today. You can change it accordingly. Type 2 is started when the insulin come to the market. Okay, so when last time only diabetes. When insulin come, okay, they say type 1. Okay, and type 2. Okay, so type 1, when send type 2 with the insulin, pancreas cannot work, this cannot do, so they confuse you. End of the day, doctors also confused because end of the day, you never reversed. You become more worse and worse. Okay, end up with diabetes, end up with kidney failure. Recently, last week, one patient came and see me. He's taking insulin for almost 8 years. So recent blood test, he go to the hospital, he check. Okay, he taking 4 times of insulin, 4 tablets, so many medicines, one bag of full. So the moment kidneys start to fail, okay, they immediately cut down all the insulin, everything. Only they say, okay, now you take only 1 time night insulin and only take 1 tablet morning. The whole time they're taking 4 times insulin for 8 years, and suddenly kidney failure, they cut down everything. What they're trying to do? Okay, from the day one, you're taking so much of medicine, end up with the kidney failure. Now they want to stop all the medication. What is their plan? By stopping the medication, the kidney will go back to the normal condition. They already spoil it. Okay. So how to prevention? Okay. So prevention start with better lifestyle. We can use the Ganotherapy method. Eating healthier food, being active always, walking always, sweat always, okay, taking medicine as directed, like Ganotherapy, taking in the correct mode, okay, taking care of your body, make sure people that lot of time taking all this insulin, everything, make sure the feed, everything is being pure, cleanly, hygienically taking care. Our Gano oil is very good for the leg, like old people who taking a lot of insulin, all these things, yeah, okay, every day you can use the Gano oil, massage to the leg, apply to the leg to make sure the blood flow in the leg are properly designed. So the Gano oil is very good to make the blood flow in the leg is good. So you don't have a varicose vein, and end of the day you don't see the leg become black. Okay, also the teeth. Okay, control blood pressure and high. Okay, high pressure and low pressure, high pressure. Okay, don't go for smoking. Okay. Okay, so all these things like smoking, taking alcohol, all these things are damaging the system. Okay, that's why metabolism lifestyle is very, very important to your system. Okay, okay. Most of the factors, if you see lack of vitamins, diabetes is all these things created. Why? Because a lot of vitamins are disappeared from the body. Okay, but in an industry, we don't supply back the nutrition that you need. But Ganoderma supply you all these things. Vitamin D, vitamin B3, B12, chromium, magnesium, zinc, lipoic acid, glutamine, glutathione, cysteine, coenzyme, glutamine, kernel, all these things already inside Ganotherapy treatment. In RGGL got, in spirulina got, in androgy got, in black cumin got, okay, in roselle got, everything is given. All these things will balance your body with the correct nutrition to make sure your system is completely superb and supplied with the essential nutrition that the body needs. With the natural, organic, nature super nutritions in the Ganotherapy and the Ganoderma treatment. Okay, this will help you to balance the overall systems. Okay, where you can get all this naturally, you can get everything from the extent. That's why you can take anything in the fabrics. The best is RGGL, androgy, black cumin, enzymes such as codipine, morenzyme. All these things will help you to supply essential nutrition to your system to balance back the system correctly. Okay. So see how Ganoderma boosts your immune system. Okay. Okay, in scientific research, found polysaccharide, active compound found in research, actually clear the blockages in arteries. So your blood flow is improved. Why the blockages happen? A lot of blockages also happen because of saturated glucose that been blocked the arteries. So when you take Ganoderma, the saturated glucose is been breaked into pieces. When break into pieces, that's why you see the moment you take Ganoderma, nobody put the sugar. But when you take RGGL, you can see your sugar raise up. You never put anything from outside to inside, but the inside glucose that's saturated start to break down. When it start to break down, you can see sugar level is going up. Actually, no harm because internal sugar is breaking down, not the external sugar that come into your body. Okay, remember that. So when the internal sugar that been break down by the Ganoderma and be diluted into the blood and just go out from your urination. So when you start to go out, all the saturated glucose that stay in your body is going out from the body. It takes minimum 3 to 6 months or 1 year to completely cleanse your arteries with all the saturated glucose. Where the storage of saturated glucose will be normally high? In a heart area, in a leg area, in the kidney, liver, okay, and other organs area, blood vessels, arteries, all these things is being saturated. So these are the things that you need to bring it out from the body. Okay, so reduce of this diabetes, obesity, so slowly you can see things. So you can do your daily diet and also eating lot of veggie. You see, by giving you a veggie, I'm not giving you a starch. By taking a lot of veggie, you are increasing your daily balanced diet. So you don't increase your starch in your body, so your sugar level won't raise. So input sugar will be minimized. Okay, if you feel fatigue or lack of energy, use Reishi extract to boost your immune. You can take more RGGL, mix in the water, you can drink. Okay, use a boost up. Red Reishi must grow in a tropical rainforest region, Southeast Asia, saturated with polysaccharides. Okay, natural biological structure of human system used to identify and kill infectious microorganisms and tumor cells. This is Argila. Okay. So you see, in US patent was issued Japanese researcher who had devised a formula treating diabetes. The formula active ingredient is actually Ganoderma, GL. Okay, this is already patented. So some of the medication system that they use, they already add in the Ganoderma already. Only you don't know. But when you eat, you think it's a diabetes medicine, but actually it's a nature. But you don't know. Okay, so many in the medication world, they also start to changing the researching and also changing the drugs. But did they is very important for them? No, actually. So they don't push too much on these things because you cannot make money on that thing. Okay, the thing is you need to be sick always, then they can make money. Okay, so using Canopoly, which all the medical science, this one, all the pharmaceutical faculty, all the documented lah. Okay, so Canopoly efficacy safe in lowering blood glucose concentration. This Canopoly is one of the extraction from the polysaccharide from Ganoderma. Okay, one of the components lah. It's actually very efficient, very efficient in a blood glucose concentration lah. Okay, this is another medical study, Institute of Vascular Medicine, Chinese University of Hong Kong. Okay, Ganoderma lucidum consumption can provide beneficial effect in treating type 2 diabetes mellitus because it's taking over the saturated glucose and balanced the pancreas to release more insulin. So we regenerate back the pancreas cells. Okay, these are the basic things you can take. A black coffee is very good. Spirulina, black cumin, androgy, morinzi, RGGL, all these items are very good for diabetes people. They can keep on taking this and you can see you start to improve. Once you start to improve, you slowly can reduce the drugs intake from your body. Okay, then slowly convert to the nature. Okay, so you must see a holistic approach. Gano works at cell level of entire body. Okay, Gano protects body from diseases as well as disorders. It gives you health, vigor, and vitality. It reduces stress, retard aging process, increase lifespan. Gano effective for all age groups from womb to womb to term. That means you pregnant also can take, baby also can take. It's been tested, verified. So you don't need to worry. Okay, suits anybody and everybody. Okay, has no interaction with other lines of treatment. It complements the same. So it called integrated medicine, adaptogen. So you don't need to worry at all. You can take it together with any type of medication system. Okay, overcome the side effect of other medication, relieve the patient. Ganoderma don't have side effects. Okay, but it clear the side effect from other medication systems, such as like modern medication, you have a lot of side effect. So while taking this, you are overcome it actually. Okay, so there's no diet restriction, liberal consumption schedule, you just follow accordingly. Okay, and even mega dosage such as 100 per day also is not harmful, because holistic approach is fruit and vegetable treatment approach. It's 100% safest approach. Okay, no bantang. Okay, no side effect, no addiction. Is everybody healthy as no and well as unhealthy. Okay, so this is the sum of the Ganoderma. Okay, we go on. Right. Okay. Okay, this is the process of cleansing, balancing, regulating, building, regeneration, and the result. So you see, when you start to take the Ganoderma, you can see the cleansing process will happen. When cleansing process happen, you are cleaning the system. After you cleaning the system, then the system start to balance. After balance, it regulate and build back the system, regenerate the system, and you can see the better result. So it take time, depend on each and everybody. Okay, so this is all the Ganoderma, organic germanium, all this kind of thing. Okay, we go on. This is the digest system. Okay, after Ganotherapy, we can see a lot of improvement into the digest system. Okay, this is FDA. Okay, this is about the accuracy of the what you call glucose meter. So it has almost 20% plus minus accuracy. So sometimes we go and check our glucose meter, we go and check. End of the day, we ourselves, we think diabetes, but actually it's not diabetes, because the accuracy of the meter actually 20% plus minus. Okay. So these are the sum of the accuracy meters that not passed in the in a FDA result, but you can buy anywhere. So it's like in Malaysia, we got China thing, or so many things lah. Okay, that small machine. That's why by checking using poke and check every day, it never give you anything. End up, you are damaging your own body. The percentage of a calculation when you do the study is like 75%, 85% correct. So if you see seal of approval, it's actually failed. So example like a One Touch Vario, Prodigy, this is all the blood glucose meter brand. Okay, a lot of machine has been failed to use, supposed to be failed, but you can see in the market, and sometimes we buy and we use. For example, like 80%, 85% only. If your sugar level is 10, okay, only 85% is verification. So it's not correct at all. So supposed to be 20% differences. So it's supposed to be lower. It's supposed to be lower, but because of the accuracy level is low, so it shows high. Okay, so you think you are diabetic, you start to eat medicine. That's why I say don't simply put the medicine. If you can balance it to naturally, go back to natural process. And you can see this is the report in 2000 something, okay, 2014, FDA banned the insulin report increase of amputation and other life-threatening disease. This FDA keep on telling, taking insulin lot, increase of amputation and treating life disease. So a lot of people taking insulin end up with leg amputation, end up with kidney failure. Okay, that's why the important is balancing your body through the nature way. By taking medication, it not help you. End up with this lah. Okay, and you can see patient tolerate multiple daily injections, suffer from once a week injection. Okay, these all the FDA news. They got so many of problems, amputations, heart failure, all related to the insulins. Okay, then increase of risk like and food amputation with diabetes medicine, canafloxacin, ivacanda, all these things. All these things has been in the website. FDA already told, but it's just for temporary only. After 2 weeks, people are go back to the normal condition. They just will take on, because everybody nowadays going for the shortcut solution. Okay, when you have a shortcut solution, you have a shortcut things lah, cutting leg and shortcut solution called dialysis lah. That's a shortcut. So balance your system. Okay, don't simply put the drugs into your body. Okay, so this is how the scientists make insulin by inserting gene and the code of the insulin protein into either yeast or bacteria. This organism become mini biofactory and start to spit out the protein, which can then harvested and purified. This is how you make insulin. This is the insulin they created. So then this is the 5 out of every 1,000 patients treated with canofloxacin. 2 out of 1 patient treated with placebo. You can see the side effect of the canofloxacin. A lot of people have the damage in the system. Okay. So many report case studies comes into the picture. Okay, so as a team, you need to find out which is true, which is the best. You ask me, the best is heal yourself with nature. You don't have any side effect at all. Okay, that's how you have to treat yourself. Okay, it's quite fast. So hopefully you can understand what you should do, okay, and learn how to balance your system naturally. That is the best way. Rather than putting drugs, you want to control shortcut way. When you start to control shortcut way, you will end up with disaster. And after the disaster came in, nobody in the world is start to help you. No, if the leg become thing, the best thing they want to do, amputate it for 20,000 just to cut your leg, 20,000 and worst case scenario, kidney failure, monthly you have to spend 5,000 so whole life of your life. So you must remember how to take care of your system. Don't simply put your body into trouble situation. When you start to put your body into trouble situation, no one there to help you, even though the highest specialists in the world also cannot help you. They will still cut your leg. Okay, so we have treated so many tons people's of legs, amputated legs, we treated back. Okay, the wound in the leg we treated back, but in the hospital, no, they start to shortcut, they just amputate and go. Kidney failure, early stages we reverse back and make them well. In hospital, they don't do that. Worst case scenario, they ask you to put the what do you call what do you call the layer in the hand to change that I forgot already the name. Okay, and they ask you to go dialysis. Okay, that's the thing. They're very straightforward. They will do because that's the solution they know. To reverse back, they never been. They don't have idea to reverse it back unless the nature people. We have the idea to reverse it back, but it need to be done in the early as possible. Okay, so prevention is the best. As much you prevent, you can save your body. Okay, your body from the disaster. Okay, so good. So any questions and answer? Okay, so any questions? Okay, there's one question. If a person is taking insulin for a couple of years, can we reverse the situation by taking Gano for how long? Okay, taking Gano for how long? The question is very tricky. We have to see how bad is your system. So you taking together, you need to take together. Make this, for example, you are taking for this patient, you can give RGGL, Androgy, black cumin, vitamin C, Roselle. You can take Morinzi. When you keep on taking that, you slowly have to reduce your insulin 1 IU per 1 IU. Every week 1 IU. When you keep on taking it together, in a long run, you start to reduce your insulin. Because so far, you never do that. And nobody teach you to do that. Every time you go to hospital, they say, okay, increase dosage, bring down the dosage, increase dosage. They never help you. Okay? By taking this Ganoderma together with what you are taking now, and slowly you have to reduce it 1 IU per 1 IU. And slowly you can see in 3 months, 6 months, 1 year, your system become more healthier and healthier. Okay, you can see the differences because I see so many thousand people already. Okay. So what are the questions? What are the next question? Okay, human therapy. Nowadays, plenty of intelligent dish, sugar, rice cooker with a way of actually body system. Okay. So any questions? Naina?
Doc, can I ask a question?
Yes.
I've been taking DXN for nearly 4 years, I think, by now. My
Okay.
sugar still go yo-yo.
Yeah, but you see, just now I teach you what's the way of eating all these things. Did you follow exactly? Okay, you need to follow exactly. You see, when you put starch, sugar will rise. Okay, you take rice on daytime only. Nighttime you change. And every time when you eat, munch properly and eat. After you eat half an hour, don't drink water. Then you slowly drink little bit by little bit. Then do your exercise. Okay, so when you start to do that with the Ganotherapy, okay, you can see the changes. That's why I say the metabolism weakness, the metabolism balancing is very, very important. Okay, very, very important. In this world, everybody's sugar will rise up when you eat. Okay, and it go down by the time frame. And it depends on how good is your digestion system. Okay, you must remember, if same size of amount of food, same starch or rice amount of food, okay, if you're giving to 3 same people, okay, same amount, all these 3 people have different reading after 1 hour. Every 1 hour you take, they have different reading. The both 3 of them won't get the same reading, even though the organs are same, but the metabolism are different. So it depends on the digestion power, the colon system, the digestion rate. So if your digestion rate are low, you might have a complete digestion in the 5th hours or 6th hours. In the industry, what they put after 2 hours must be 5. Wrong. Okay, because if it like that, if you eat the same food of 3 of you, same time you will get angry. But why you don't get hungry in the same time? You understand, Dana? Okay, if I give you 100 gram of rice, 3 people eating the same time, same 100 gram of rice, did the same amount of sugar level will be get every 1 hour of the each of 3%? You won't get, because it depends on the digestion system. If your digestion system, metabolism are weak, okay, the each 3 of them will have a different time of hungerness. It won't be the same, and the sugar level won't be the same. So we have to see what are the range of your metabolism range. Maybe your colon system, after it takes 4 hours to 5 hours, then only you complete digest. Okay, so you have to see that also. From that, you think that you are diabetes, you start to eating medicine. Okay, at the same time, you need to burn up your glucose. How to burn up the glucose? Do some activity that you can sweat. The moment your body is sweating, you create your activity, your blood circulatory system start to running. When the blood circulatory system start to running, your sugar is automatically used as energy. That's why in this world, athletics, who are people who are very active in sport, don't have diabetes at all. And they don't get it at all because all the sugar has been utilized. But the problem is nowadays, we don't do any activity. Our activity is makan, tidur. Sit down, TV, watching television, play game, play WhatsApp, finish. For the fingers only you give activity. To the eye you give activity. Okay? For
Zoom
the body,
meeting, Zoom meeting.
Zoom meeting. Okay? So last time from Zoom meeting, I need to do Zumba meeting. Zumba dance. So you have sweat a lot. Okay? So you need to change. Okay? Change accordingly what I say. First thing is your food. Second thing, your exercise. Okay.
Exercise no nowadays.
Now then how? Makan tidur, everything saturated inside lah. Okay. So change.
Look,
Then you can see.
You want to ask what?
I want to ask something, Doc, here.
Yeah.
Yeah, every time I
Hello?
LRG
Hello?
and black cumin, right?
Ah.
Can you hear me now?
Hello.
Can you hear me? Okay, I've been taking this Andro G1, L1, black cumin one, night and day, right? Twice. I
Can take 3
use
times
it
daily.
so every
Your line is very
but
bad, Felix.
after a few hours, like yes, it's because I'm using a phone.
Okay.
Yeah,
Your
and then
lines,
after a few hours taking those. Okay,
hello?
can you? Hello.
Breaking.
Yeah, I use.
Ask him to use my phone. Here.
Okay, here.
Okay. Yeah, he was in the same room.
Because I use
you,
another one actually. I use another one. Yeah.
Okay. Yeah.
Right. Okay. Now I've been taking this Andro-G, RGGL, and black cumin, right?
Okay.
Yeah. And then twice a day, morning and night. Then I'm like, after a few hours, then my urine is very bubble after that. Well, what caused that? Maybe because of that.
It's some
GL.
cleansing process happening. Drink a lot of water.
Oh.
Okay, drink water because how long?
Yeah,
before
now.
Yeah.
Yeah, 2 liters of water.
Okay. You drink
Every
water.
day now.
You drink water sip by sip. Don't drink glass by glass. Okay. Then balance your water level into it. Too much water also not good to the system. So then you need a sweat exercise.
Oh.
You need to sweat exercise. When you sweat it out, you see our sugar sometimes will stay underneath your skin. When you start to sweat, you are cleansing the underwater, under skin sugar. Because it's keep on staying all over our body. You need to cleanse it out from the body. So it takes certain time frame. Each and everybody have a different time frame. So you continue taking, do exercise, and I teach you the way of eating. Take more greens. You see, while taking more greens, veggie, okay, you don't increase starch. So you don't increase sugar. By taking fish, by taking chicken, you're not increasing sugar. Okay, you're not increasing starch. So you need to balance food. At the same time, you need to balance exercise. And whatever you give inside, sometimes your sugar will raise up, as I told you. Why? Because start to break all your saturated sugar last time you keep inside. First, you need to cleanse it. After cleansing, then you will come into a balancing mode. So from the cleansing mode to balancing mode, it takes time frame. Okay, it depends on each and everybody metabolism. So you need to be patient in anything. You see, whatever product that you take, sugar intake inside. Okay, but when you take it, you can see your sugar level is not balanced. But then, if not balanced, you need to increase the dosage. Maybe for your body, you need maybe 3 times or 2 to 3 times, maybe high dosage a bit. Because, okay, you understand? You need more, maybe more dosages. Once your system stabilizes, then you need to reduce the dosages. But for the first time being, lot of sugar has been saturated inside. You are taking tablets or insulin?
No, I'm not taking anything. Actually, no.
Okay. So you just balance your body.
Because I didn't go to the hospital lately.
Okay. So you take the thing, you do exercise, you control your food.
Yeah, because they want to give me the pills. I said I don't want it because I've just got my HB1AC. That one. They told me it's 7 is very high already.
No. Below 8 is okay. Below is okay. You need to go bring it down. When you do a lot of exercise, automatically it will come down. Okay, that's why sweating is very important.
Yeah, I did the prick test. Can we trust the prick test, the pen test that using that strip?
That one, the small one. That one got 20% differences. Cannot.
Oh.
Lot of machine that you use is not correct. It's got 20, even though FDA already warned, but none of the doctor will open mouth. Okay, when your reading is 10, actually it's only 7.5. Okay, okay, but you think 10, so you think increase. So because the accuracy is not correct, the accuracy also it also depends on the amount of blood you put inside the strip. Okay, so each strip at 0.3 micro, 0.5 micro to get the proper result. Sometimes we just take a poke, we just put little bit, then we calculate. So it's not the appropriate correct calculation. Second thing, each strip have a different kind of things. And we are wasting so much money in the strip and calculating. End of the day, if your sugar go up or sugar go down, is based on your body. You need to balance it. Okay, so we need to balance the sugar. Last time our parents are eating a lot of rice, also no sugar one, because they never bother to check, because they don't have any problem. We nowadays, even though we don't see, we go and simply check for what? If you check, you go improve, never mind. You check, you don't get improved, you're getting worse. God lah. Did anybody improve after taking medication? No one. Did anybody improve? No. After 5 years, 10 years, they just cheating themselves. Oh, I'm showing the report. Oh, my report good, 5. End of the day, kidney spoiled already. After 10 years. But all the 5, 10 years, 9 years, they said, oh, my glucose is under control. Very smart, telling. Under control. End of the kidney spoiled. Who want to help you now? But 10 years you're taking medicine non-stop. That's why a lot of dialysis patient nowadays is taking medication, people, and never change, never improve. So if they improve, we can do. But the improvement is in your hand. Doing exercise, taking a good food, taking more veggie, balance your diet, okay, exercise, sweat every day, taking nature medication, that will help you in the long run. The drugs is a shortcut method. You're not helping. You just temporarily bring it down. Tomorrow morning still go upward. So tomorrow morning you don't die. Correct or not?
Yeah.
I see so many people now 4 times insulin, 10. Okay, taking medicine. Oh, then they show, okay, night check 5. Tomorrow morning they check 20. Tomorrow morning never die. So what we are doing now? We are cheating our own system. So we need to change the system into a proper balancing mode. Okay, so then slowly we have to cut down the medication. I don't say medication is wrong. You can take medication, but in a short term, in a long run, you need to balance your body into a correct method of living. Then you can live, you can take care of your kidney, you take care of your liver, your system become better. That's how you need to balance your system. Okay? Okay, clear?
All right.
Okay, good.
Clear. And one more thing, Doc. How about I'm taking amlodipine also, Doc. This for high blood pressure.
Amlodipine, you see, your amlodipine is the drug for the pressure, blood pressure. That is actually you are taking or not taking almost same. Okay, because only 5 mg to 10 mg. Okay, so the important is, if your pressure is very mild, they will normally give that thing. If you can maintain your mind control, balancing, okay, do some yoga, control your mind, balance, you check, if okay, you don't need to take. But if you cannot control, you can take it. But in the long run, it's not good, because you end up with, you are increasing the medicine later. You are increasing. But 5 become 10, then they give you any additional medicine again. For what? So most of the pressure is your mind pressure, not your heart pressure. So control your mind. Don't be tension. Then you increase your pressure.
Okay.
When you laugh, when you happy, the pressure don't have. When you tension, automatically pressure go up. So when I give you too much of pressure medicine, if your tension also, no point what? The pressure won't go down, because it's a mind control, mind problem, not your heart problem. Okay?
Yeah, sometimes I feel like palpitation a bit sometimes.
Yeah, because you're scared.
Yeah.
You're scared. You don't be feared. You balance your body. You relax. Okay? You tell your system you're the best system in the world you have. So you need to balance it by relaxing. So close your eye when you have pressure. Okay, you close your eye, count 10 to 0. Then you check. Pressure will go down.
Because Doc, every day I meet the doctor at the PPV, because I'm a volunteer there. Because this doctor always ask me question, how are you today? Because I'm a volunteer.
The moment you see him, automatically pressure go up lah.
Yeah, see, no lah, but actually we walk there. So this doctor control the flow lah, the PPV where vaccine all around there. So we are volunteer to work with the registration. And the doctor came to me and said, hey, how are you today, Felix? Okay, no? I said, how's your pressure today?
Pressure naik lah.
Talking about pressure today.
Remember always, pressure is your mind.
When I saw her, and then he said, this doctor come see me.
Looking his face also pressure already.
Yeah. All right, Doc. Good. Thank
Okay,
you. Thank
okay,
you for your
good,
advice.
good, yeah.
Right.
Okay, 9:25 ready. So what, any other questions?
Yes, Doc, in the chat group, Doc.
Ah. Okay, what product to take for diabetes is standard lah. You can take RGGL, Androgy, Black Cumin, Rosal, Morinci. You can take Fruxim, you can take Codipine, no problem. All these things is helpful for the diabetes because we are balancing the metabolism balancing. Once the metabolism balancing, your system go back to normal condition. And also same thing as I teach you, the eating habit, exercise, okay, mind relaxation, all very important to balance your overall system. Okay. What else? Thank you. Okay, I think nothing much lah. Huh? Okay, does it different change in type of rice we take to reduce starch content? Actually, nothing much. Rice is actually not much playing big role, but always I encourage to take the rice lunchtime, night change. Okay, change to other type of food. Okay, that's the best. Morning and night you change. You don't take rice. Lunch you take rice, but nowadays in Malaysia, you know lah, pagi nasi lemak, malam nasi lemak, tengah hari nasi lemak, habis lah. So balance your food. Okay.
Oh, there is a question from Andy. Diagnose virus in the stomach. What are the DXN products?
Or diagnose virus in the stomach. Okay, virus you can take psyllium. You know we have psyllium, psyllium capsule. You can take psyllium, RGGL and Androgy. It will help you. And also you can take microAG morenzyme to cleanse the colon. You can take that, then should be okay. Okay.
That's the last question.
Does wheat contribute heavy starch? Okay, it's all depend on your, as I told you, you can take starch, but remember, neutralize the starch using your amylase. So when you take starch, you must munch properly. So when you munch properly, then good glucose automatically will produce. When you start to create a good glucose, your pancreas will endorse the insulin to the glucose. So it's not the starch problem, it's your eating problem. Okay, a lot of people never munch using the amylase. They swallow the food. Remember, the amylase only activate in your mouth, not in your stomach. Okay, remember that. Okay, if you don't create the amylase, the starch won't convert it into maltose. If you don't create a maltose, your small intestine cannot convert the maltose into maltase that they can be combined, become a glucose. Remember that. Okay, because small intestine create maltase enzyme. Okay, when maltase enzyme get a maltose from you converted from your mouth, okay, then only glucose will create it. This is the formula, nature formula, you can't change it. So, but you have to help it to create it. Okay, so remember to munch your food, use your amylase. Slowly eat. Last time people already tell us, slow eat, slow eat, slow eat. Where they got slow eat? Everything on to wala. Takut chicken habis faster. Okay, so you need to follow the procedures, process, metabolism. That is very important. Once you follow that, everything will go back to normal. The first process is correct, every process will be correct. The first process is wrong, every step is wrong. Okay, clear? Good. Okay.
Can suggest how many in this group have put Gano oil in their ears for the last 4 years?
Okay. Okay. So I think 9:30 ready. We can close the session. So later I will upload to the WhatsApp group, then YouTube, then you can see lah. Okay. Okay. So thank you for today's event. Hope you all understand and make yourself clear on this diabetes. And the message I given, you want to test it, working or not working, you follow what I say, because it already worked so many thousand people's. Okay, it's supposed to work for you. Okay, because your system is the best system in the world. Okay, so thank you for today. Okay, I'll stop.
Doc,
Yeah,
Doc,
yeah,
hello.
yeah.
Can we have the copy of your slides?
No, I will put the YouTube. You will get from the YouTube. Okay, I will upload to the YouTube later.